Good evening. My name is Keri Lewis. I'm the Executive Director of Interval House of Ottawa, and I've been working in gender-based violence shelters for over 25 years. Every day at Interval House of Ottawa, we meet people at some of the most dangerous and vulnerable moments of their lives. They arrive with bruises and broken bones, but also with injuries that don't show up on x-rays, injuries that live in their bodies, their memories, and their nervous systems. Gender-based violence isn't just a social issue, it's a public health crisis. And if we want to respond meaningfully, we have to see and treat the full impact it leaves behind. In 2024, Ottawa police responded to 6,636 incidents of partner violence in Ottawa, nearly 18 calls every single day. 79% of the victims identified as female, and those are only the ones we know about. At our shelter, we see the tip of the iceberg, survivors who've endured years of abuse, often while navigating racism, poverty, colonization, or immigration barriers. Their health needs are urgent, complex, and often misunderstood. Survivors come to us with injuries, broken bones, burns, chronic pain, but one of the most serious and least recognized is traumatic brain injury, often from blows to the head or strangulation. A survivor might seem forgetful, disorganized, or emotionally volatile. She might lose track of appointments or struggle to remember conversations. These aren't personal failings, they're neurological injuries. Beyond that, trauma shows up in the body. 93% of Ottawa shelter residents report physical symptoms: headaches, insomnia, digestive issues, menstrual changes. And when they do seek medical care, they're rarely asked about abuse. Their pain is treated in fragments, not as part of a larger story of violence. Mentally, the toll is just as profound. 73% of women in Ottawa shelters report post-traumatic stress disorder symptoms. 60% report depression. A third meet the criteria for major depressive disorder. Trauma changes the brain, the body, and the way people move through the world. And when systems ignore that, they reinforce the harm. When survivors reach out for help, they often find that the system doesn't see them. Leaving violence usually means leaving everything behind: ID, health cards, medical records. Even when they find a doctor, a 15-minute appointment can't hold the weight of complex trauma. Publicly funded trauma therapy is almost non-existent, and gender-based violence shelters in Ottawa don't receive psychiatric outreach. For Indigenous and racialized survivors, the barriers are even steeper. Racism in healthcare isn't hypothetical, it's documented and ongoing. 1 in 5 Indigenous people in Canada reports experiencing racism from healthcare providers. Indigenous patients are more likely to leave emergency rooms without care, to wait longer, and to receive less pain management. The death of Joyce Echaquan, an Atikamekw woman who live-streamed her final moments as hospital staff hurled racist insults, showed the country what Indigenous people have said for generations: this system is not built for them. Imagine fleeing violence, sustaining head trauma, and then being disbelieved or dismissed in emergency rooms. Many don't go back, and their health deteriorates further. So how do we do better? We can't end gender-based violence overnight, but we can transform how systems respond to it. First, the provincial government must ensure that gender-based violence is recognized and prioritized as a health issue, not just a social one. Healthcare is a provincial mandate, and that means Ontario has the power and responsibility to act. Ontario's recent declaration that gender-based violence is endemic is a good first step. Additionally, the province should require trauma and violence-informed care training for all frontline health providers, nurses, doctors, paramedics, and mental health clinicians. This training must be mandatory, built into medical and nursing education, and developed in consultation with gender-based violence experts and service providers. Every healthcare provider should understand how trauma and violence shape the body, behavior, and trust, so they can recognize the signs, Ask the right questions safely, and respond without judgment. Second, we need cross-sector coordination that connects healthcare with the gender-based violence and community sectors. Hospitals and community health organizations should have policies and procedures to screen for and respond to gender-based violence in a trauma and violence-informed way. This includes safe disclosure processes, clear referral pathways, and shared accountability. Care should not depend on who you happen to see or whether they get it. Coordination should be mandated, not optional. Third, we need strong municipal coordination. Across Ontario, every municipality is required to have a community safety and well-being plan. These plans can be powerful tools when they're used well. They bring together shelters, housing, public health, municipal services, and mental health providers, the local systems that shape survivors' daily lives. By embedding gender-based violence prevention and trauma-informed practice into community safety and well-being plans, municipalities can ensure that local services are aligned and responsive. But hospitals and primary care, those remain provincial responsibilities. That's where the province must lead, while municipalities ensure local coordination on the ground. We already know what works. Shelters aren't just places of refuge. They're frontline health access points. Every intake is a chance to identify brain injury, address untreated conditions, and connect survivors to care. We need trauma-informed integrated systems where healthcare, housing, and mental health work hand in hand. We need culturally safe, anti-racist services led by Indigenous communities and guided by lived experience. And we need to invest in time. Time to listen, time to build trust, time to heal. Because survivors are not broken. They are carrying injuries, some visible, many not. And when systems meet them with respect, connection, and care, healing is not only possible, it's powerful. Gender-based violence is not inevitable. Its health consequences are not inevitable, but ignoring them is a choice, and so is doing better. Thank you.